This is Dr. Joe Adragna, medical advisor to the public health director, Montrose County, and the pandemic specialist reporting to the Board of Health. I'm coming to you today on March 17, 2021 with an update for you to keep you up to date on what's going on with COVID-19. Let's get right into it. First off, we're going to talk about prevention, then we're going to go into the status, and then I want to talk to you today about the economic impact and the data we're seeing. First off, on prevention, if you haven't already signed up on the standby list, then please do so if you don't qualify according to the current phase 1 schedule that the state has put out. Now, we'll talk about phase 1B4, which becomes eligible this week, later this week on Friday, the 19th. But if you're not in that eligibility in phase 1, maybe you're a 20-year-old person that doesn't have any health conditions and you don't work in an industry that's considered essential at this point or at high risk, go ahead and sign up on the standby list. We are encouraging that. We ask you to do that, and we want to get these vaccines out to as many people that we can so that we can end the pandemic. And so what happens is people register for spots, but we have about a 10% no-show rate. And so if we see that, we'll call our standby list and say, hey, we've got an opening. Can you make it down here today and get the shot? And so if that's something you'd be interested in, please sign up on MontroseCountyJIC.com. That's MontroseCountyJIC.com. And oh, by the way, if you haven't already smashed that thumbs up button on the YouTube algorithm, it would really help us. It helps make sure that this video pops up for other people that want to know more about COVID-19 in Montrose County. And so please subscribe. Notifications are great too. I use them myself so that when people post a video that I'm interested in, I'll be one of the first to know and can use it when I've got time, or at least view it when I've got time. So first off, the COVID-19 vaccine distribution plan has not changed from the state. You can still see it's the phase 1A through phase 1B4 that we have previously viewed, and then we've got phase 2, which is the general public. So phase 1B4 goes live on March 19th. So that's people age 50 and older, student-facing higher education employees, frontline essential workers in food and restaurant services, frontline essential workers in manufacturing, U.S. Postal Service, public transit and specialized transportation, public health workers, human service workers, faith leaders, frontline essential direct care providers for Coloradans experiencing homelessness, essential journalists, continuity of local government, adults who received a placebo during the COVID-19 vaccine clinical trial, continuation of operations for state government, and then people 16 to 49, remember 16 and 17 only for Pfizer, 18 and above required for Moderna and for the Janssen, otherwise known as the Johnson & Johnson vaccine. But those great groups, 16 to 49, who have one high-risk condition, they can be found on the CDPHE COVID-19 specific site for vaccines. But hey, if you don't meet that criteria, which is pretty broad, sign up on the standby list. We'll get you taken care of. And remember, you don't have to verify your health condition. You don't have to verify your employment. You self-attest that you meet that criteria. Our goal is shots in arms. You do need to be age appropriate. We do take that very seriously. We have had some people fraudulently obtain the vaccine, reporting inappropriately their age. That's not okay. We're not asking people to lie. We want to be safe as safe as we can. Is it going to hurt a 17-year-old who gets Moderna vaccine? We just don't know. And we also are on the line having made promises to CDC that we are going to follow the rules and make sure that this is given to those who are age appropriate to receive it. So please don't hurt others by you lying and potentially harming our operations. Now, that being said, March 19th, that's Friday, that's when phase 1B4 becomes live. So right now, we're still in the phase 1B3 category. Again, if you don't meet the current criteria, just sign up on the standby list. You will probably get a vaccine within a week, maybe next week, but we want shots in arms. So, did I remind you, the standby list, that's MontroseCountyJIC.com, Montrose County JIC. JIC, if you're wondering, stands for Joint Information Center. By the way, did you hit that thumbs up button yet? Vaccine plans this week. On Wednesday at Friendship Hall, we're doing about 1,300 doses of vaccine. On Thursday, about 600. And on Saturday, about 1,000. And so we're hoping to see you there. If you're on the list, if you're registered, or if you're interested but not yet on the list, go to MontroseCountyJIC.com and get registered. Now, vaccines nationally, 109 million doses have been administered. In total, 71 million people who have received at least one dose. And that's 21% of the population. That's amazing. When we look at those vaccines, 64% have been given to people that are 65 years and older. That number is going to continue to go down as a percentage as we open up additional tiering here and we get younger people into the vaccine eligibility rolls. Now, fully vaccinated, we're looking at 38 million people. 38 million people have been fully vaccinated. That's wonderful to see. That's 11.5% of our population. Now, let's look at the state data on the table below. You'll see that vaccine providers continue to grow. I'm going to get my head out of your way here. So 1,080 vaccine providers as of March 15th, growing every week. We'd love to see that. And the cumulative doses administered in Colorado now at 1.8 million doses. That's wonderful to see. And Coloradans that are fully immunized at 745,000 people. When we look on our region here, our region as defined by the state is Montrose County, Delta, Gunnison, San Miguel, Ouray, and Hinsdale. Montrose County has done over 16,000 doses of vaccine in arms. And of those, most of those are in females. You can see here on this graph, this is looking at the region data. So 54.5% of recipients have been female. Most of them have been in the 60 and plus group, but you can see that there are younger populations that have received the vaccine due to health conditions or due to their job. And then if we look at ethnicity, a bit overrepresented for our population in white, non-Hispanic. And so we are hoping that we get more of our Hispanic population into the vaccine clinic because everybody matters. Let me get my head out of your way again. Everybody matters. You know that. I know that. And it protects all of us to make sure that our entire community has access to this vaccine. And so we hope that if somebody's on the sideline, we hope that you'll come in, do the research, and get the vaccine. And so on Saturday, that's actually a health equity focused clinic. And so we're trying to target those people that maybe have been sitting on the sideline and have been hesitant to come in for various reasons. Like I said, we're not verifying health information. We're not verifying employment. And you don't technically need to show a photo ID. We do need to be able to verify your age because of some recent fraudulent activity. But that's only for the purposes of making sure that you're safe to receive the vaccine. So we hope that all will receive it that work or live within Montrose County and are age appropriate. Now, if we look to the bottom and we see the difference between percent of doses distributed and the percent of the state population, Montrose is showing at 0.12%. So we've gotten a little bit more in distribution to our area than our percent of the state population. That number has gone up and down over time. So at one point, after some advocacy efforts that our county commissioners and our legislators put forth, we were able to get that number up to 0.09%. And then late February, there was some reduction in supply, partly due to weather issues out of Texas, and the supply chain got disrupted. That number dropped down to 0.04 and now back up to 0.12, potentially because we're able to do that health equity clinic on Saturday. So we're happy to see that vaccine is distributed across the state, and we're happy that Montrose has gotten a fair share of the vaccines. So now let's look at the status, the data summary of where we're at with COVID-19. And you're about 8 minutes in. Awesome. Thanks for watching. It's only going to get better from here, but smash that thumbs up button if you haven't already. So now we're going to look at the state's dial. So we were reported just over 60 last week on our 1 week cumulative incidence. That's per 100,000. And so now as of March 15th, again, my head out of your way, you can see March 15th, we are showing 23.4. Now there's going to be little variation in that day by day. And so, don't take this as written in stone. It'll change tomorrow. But on this date, it was 23.4. Our percent positivity in the 1 week average, 1.3%. So 1.3% of PCR-based tests came back positive. And we had 13 days of declining or stable hospitalizations in Montrose. That has not been a problem for quite some time. So when we look at COVID cases on a 14-day case count per 100,000 population, over time, we see that represented in gray here. Gray. And we see that number continues to fall from its peak back in early December. And the black is showing the total COVID positive and persons under investigation hospital census. Okay, so this actually went down to 0, which we're really happy to see, and it followed the model at 0, but it bounced back up to 3 with some recent admissions. They're back down to 2 with a discharge. So we have had some persons return to the hospital, not return, but be admitted to the hospital with COVID. So it's not gone, and we never said it was gone. We said, hey, the model is looking really good, but don't be surprised if we do have some additional cases here and there. Hopefully these people are recovering quickly and can be discharged as soon as medically reasonable to do so. Let's look at the model though next. So if we look to the model, what we see here is that the blue is the modeled census for COVID positive. So it excludes persons under investigation in this representation. It's only COVID positive. And then if we look at the yellow, you're looking at COVID positive hospital census on that day. And so as reported, it got up to 3, now down to 2, but this hasn't been updated since the 15th. So we were projecting based on these parameters for public health effectiveness that you'd be at a sustained level of 0. But remember, on my commentary, I said, don't believe that you're just going to stay at 0 forever. COVID's still there, so you're going to have little ups and downs here. Remember, this is a small sample size overall, and so little variations, like let's say I'm 100% wrong, that could mean a couple people in the hospital here. So this model also doesn't consider variance and the potential changes that would have on projections. It doesn't know about waning immunity, because we don't know about waning immunity. How long does natural infection keep you safe for? We think maybe 90 days. What about vaccine protection? How long does that last? What if you didn't get your booster dose? What happens then? And there's also a potential that we could have a concentrated high-risk exposure event in people that aren't infected. The people that were most recently hospitalized were all older folks and in the 70s and 80 age range. And so we still see that high-risk population group. So if you're in that age group or your loved one's in that age group, please stop sitting on the sideline with the vaccine unless you have a contraindication to it, which really is just anaphylaxis to an ingredient with it. The vaccine is safe, it's good, and it allows us to fight back against COVID. That being said, one other risk factor following the model here is that it may overestimate the number of immune persons in our community in this model. So, for example, I don't know how many people who are received the vaccine also had COVID, and many people wouldn't know anyways, because there has been so much asymptomatic spread of COVID in the last year that it's possible somebody could have had COVID, not known it, had antibodies, were not susceptible, but got the COVID vaccine, which is still a good thing. We still recommend that even if you had the virus, that you go forward and get the vaccine, because it is likely to extend the duration of your immunity beyond just the duration of natural immunity, thought to only last about 90 days. Now, probably more than 90 days for a lot of people, but there has been over 800 infections known in Colorado for people that had COVID and then contracted it again after 90 days. So it is a real risk. So please get the vaccine. When we look at our region, so I'm just going to move my head around so you can see the rest of the graph here for just a moment. So what we're looking at on our y-axis is the 14-day case count per 100,000, and on your x-axis you're looking at different counties. Montrose shown here, second in from the left, and then you can see your table looks at different dates. So on this date, what was the 14-day case count per 100,000 population? So you can then see that this is adjusted for population size. So if you look across this area, La Plata and Pitkin County are the only two that I've highlighted in red with their most recent bar, and the reason for that is that those bars are up from what was reported last week. Every other county was down on its 14-day case count per 100,000 population. And remember, the other way I look at this is that it's representing community prevalence. So if I compare Delta to Montrose, for example, Delta's at 77, Montrose is at 89. Well, it's population adjusted. So I'd say Delta has a slightly lower prevalence of COVID-19. Now, there are other variables that I'm not talking about there, such as, does the community have access to testing? Does the community believe in testing? Is the community only doing targeted testing, or are they doing mass testing? Does everybody get a test when they go to Starbucks, or they only get it when they go to their doctor, and they only get it when they're sick? So lots of variables here can play into that. Remember, there were probably more than 89 cases per 100,000 in the 14 days ending March 15th. Those are just the ones we know about. Let's look at our region defined by the state. Remember, this is the West region, so it's Delta, Gunnison, Montrose, San Miguel, Urane, Hinsdale. And this graph, I think, is fantastic. So it shows you on the top in black this 3-day average daily incidence smoothing trend line. So it's trying to smooth out all these little gray dots that you see in the background so that you get a better visual representation of that 3-day average daily incidence. And then the bottom graph that's shown in green here is showing you the daily change in the slope of that smoothing trend line. So before your head explodes, smash that thumbs up button. But think about this for just a moment. What it's telling you is that the rate of change is changing over time. So if you have a precipitous fall, like you're falling off of a waterfall, then the daily change in the slope of that line is going to grow. And in this case, it's represented in the negative because your cases are going down. So what we want to see is a low line. We want to see a low number. If it's close to 0 on the green line, it means that you have essentially flattened out and that you're holding steady. If it goes above 0 and it's positive, then in the way that the state has represented this, it will turn red. But what that means is that you're going up and you're gaining cases on a 3-day average daily incidence. What we want is a green line that's highly negative. Now, our line was more negative in the past as we had more of a precipitous fall in our 14-day case count back in January. And we have slowed down the rate of decline since then, almost hitting 0 in late February. We picked up a little bit of speed in the positive way, in the good sense, in the first week of March, and then we slowed down a little bit more. But it looks like we are not going to cross over the 0 mark, hoping that holds true. Let's look at the state. So the statewide 7-day average of COVID cases has seen a couple of ripples here in the past few weeks. Late February had a little bit of an upswing and then down, and then just last week an upswing as well. So let's look and see what that's doing to the on the incidence curves. But remember, look where we were. Over 5,000 cases on a 7-day average back in late November, early December. And now we're talking about less than 1,000. So significant reduction. This is overall good news and has moved in the right direction. But when we look on that slope of the smoothing trend line, we do see just what we said. There's been some hiccups here. So in late February, we actually went positive and there was a growing number of cases, but it didn't hold long, and very quickly, after just about a week, it started to go down again. Then we went back up and you can see that around March 13th or so, we kind of peaked on this slope of the smoothing trend line and then have started to come back down again. So the state is still in the positive, it's still on the climb, but the rate of that climb is starting to slow. And then hopefully it'll then fall off again and you'll go back into green territory and you'll see reductions in cases. So now let's look at what's going on in the hospitals. The bottom graph here is the important one. It's showing you how many people are COVID positive and in the hospitals. So that's shown here in green, and in yellow you've got those that are persons under investigation. So there's usually not very many of those now, since we can get rapid test results back very quickly that are highly sensitive. So numbers are going down, just a slight little uptick at the farthest right we can go on this, but very minimal, and we've seen that before. It's like a sawtooth or a ticker symbol. It'll fall back down. And when we look to the acute care bed use and ICU bed use, this is not looking at just COVID positive patients, but it's looking at all bed use. And in those ones, we're seeing stability. Acute bed use and ICU bed use is stable at 0% change from last week on a 7-day average. Okay. Now let's talk about the economic impact in Montrose. This isn't going to be a super detailed theory, and I'm not an economist. I'm going to show some data about activities and movement, and you can make the judgments for yourself where we're at. So on the top left here, we're looking at mobility relative to pre-COVID averages. So for example, the top one is percent time not at home. So this is the percent of time that you're out of your home. The dark blue represents Montrose relative to pre-COVID, and the blue, light blue, is statewide. So what that tells me is Montrose is out and about more than the state average, but not as much as pre-COVID. So we still have room to gain in our mobility figure there. If we were at 100%, that means we would have spent the same amount of time not at home now as we did pre-COVID. And you can see that we still have room to grow there. People are still spending more time at home. Maybe that's because they don't have a job. Maybe that's because they're afraid. Maybe that's because they just don't want to and their interest changed. I don't know. But for whatever reason, we have not returned back to our pre-COVID level in the amount of time not spent at home. If we look at time in restaurants, significantly higher percent of time that Montrose residents are spending in a restaurant compared to statewide averages, but still not at our pre-COVID level. Time in retail, slightly better than statewide average, 20% down from our pre-COVID levels, and so on and so forth. Montrose County is above on all of these metrics: contacts per device, new contacts per device, time spent at work or at school, time visiting other homes, although that's very slightly above the statewide average, pretty close, etc. So the takeaway there is we're not back to where we were before COVID. We're still down on our amount of contacts that we have. We're down on the amount of time that we spend outside of our home, and we are down on the amount of time that we spend in retail, restaurants, and visiting other people in their home. Now, when we look at restaurants specifically in the top right, you can see this is just looking at from January 1st through March 14th. And what you're looking at here is at restaurant activity in Montrose County. And so this set shows about a 20% improvement in activity now compared with January 1st. So restaurants getting better, but it's slow. And the amount of time that people are spending in restaurants is still down from pre-COVID levels. If we look, I want to blow up this time spent not at home. Just look at that one more time, just to highlight this. This is showing the percent time, so time spent not at home, okay? So Montrose had a smaller percent of time not at home than the statewide average pre-COVID. During COVID, that flipped. Montrose had a higher percent than statewide average of time spent not at home. And today, we still have that effect. And so Montrose spent less time not at home, meaning we spent more time at home pre-COVID than the statewide average. But since since COVID, over the state is spending more of their time at home than Montrose residents are. So it's all relative. But what's your measuring stick? So if you measure us against statewide averages, we're more mobile, we're getting out of our house, we're doing more than our peers across the state might be on average. But we're still not doing as much as we did before the COVID pandemic. And before the COVID pandemic, the state actually had a higher percent of time spent not at home than Montrose County. So going on a little bit more, just one last thing on the restaurants. If you just visualize the amount of visits, weekends and weekday per week, going back to December of 2020, you can see that apples to apples, restaurants are still down in terms of activity. Now, what's interesting is during the summer months, just before 4th of July, we actually had higher visits for a very short period of time to restaurants, and we had it repeat again in August than we did in pre-COVID. Now, it was a different quarter. It's not comparing year-to-year summer numbers against summer numbers, but we are still significantly down from our pre-COVID numbers year over year, and we're down from our summer numbers in restaurant visits. Now, if you look to the top right, Domo, the source of data that we're talking about here, says that Montrose now has a 7-day average social distancing of 12%. In the past, we were at 58% back a year ago in April, just under a year ago, and 33% in July and 0% in October. So if you stop and you ask yourself, do I think Montrose is more active with less social distancing than we were back in April of 2020? I think, yeah, we're not shut down like we were. So that makes sense to me. But if you look at October, when we had this big increase in cases as well in Montrose, that did fit that we had actually gotten to 0%. We were just kind of all over it. Schools has opened up. We were looking good. Cases were down. We were even thinking about applying for Protect Our Neighbor, and then boom, we got hit with a big spread across the state, across the country at that time. So just another point on activity levels. If we look to the bottom chart here, we are seeing an increased amount of activity at schools in Montrose County. That's good to see. And I think that correlates with the school district going to all in person. And good on Montrose County School District. Many of their schools were open year round. They never went into a shutdown, full shutdown at least. And then their secondary schools have recently just gone all in person, except for those that are undergoing some asbestos abatement. So well done, Montrose County School District, and a big tip of the hat to James Pavlich, who led the charge over there as their director of safety. Did a great job. So let's look over here. This is comparing different industries in Montrose County and looking at year over year. So restaurants and bars down 14% year over year. Retail and storefront down 15%. Grocery stores down 27.7% year over year change. Indoor exercise locations, you guessed it, up 15.7%, which actually kind of fits because if you go drive around and look at some of these parking lots, they are packed. And so I can believe that one. And then on outdoor rec locations, down 18% year over year. That surprised me to see that. We have had other periods where we've been above, so that one fluctuates quite a bit, but last report down. So that's our report for March 17, 2021, Montrose County COVID update. Overall, we are doing pretty good. We're doing very good, actually. I'll take that back. Very good. I just don't want you to think that that you should do away with all the good things that you've done. We're not totally out of the woods. As I said, there's still 3 people that got hospitalized, admitted just in the last few days with COVID. It's still out there. If you're in that high-risk group, you need to take care of yourself and you need to get off of the sideline and get the COVID vaccine. It's safe. It's good for you. Unless you have a contraindication, which is very rare. Like if you have an anaphylactic reaction history to some ingredient, by all means, please don't get it. We don't want anybody getting hurt from this. But when I look and I see over 500,000 dead Americans, which I think is an underestimate, and I compare that to the soreness that you might get at your arm, it's apples to oranges. Sure, there are reported deaths with these vaccines, temporal related, but nothing's been connected. And they're so small in number. Of course, any one is tragic, but standing to lose another 500,000 Americans is just unfathomable. So please do your part. I think the vaccine's very safe. 109 million doses given, and it has helped us to return some semblance of normalcy. And it's our way to say thank you so much, state and federal public health agencies. Thank you, local public health efforts. We are good to take care of ourselves and get back to some semblance of normalcy here. We can't do that when there is still cases and deaths going on, okay? So appreciate everything that you've done personally during this. I know that many have sacrificed and many have lost loved ones, friends and family members. I have certainly lost many patients in the last year because of this pandemic. I hope it never, it's nothing like this never happens again in our lifetime. But we have a weapon. It's called the vaccine. Get it. Let's shut it down. Let's get back to normal. You guys take care of yourself. We'll see you next week. Smash that thumbs up button. Subscribe. Hit the notification bell. We'll talk later. Bye.